Okay, starting. Okay, here is part 2 of the interview, Nurse Practitioner Closer Look at several states. And so this will be including Taylor Brockman.
Hi.
Taylor lives in Honolulu, Hawaii with her husband and dog, and she moved to Hawaii a year and a half ago, but was born and raised in Orlando, Florida. She's been an RN for 3 years now and has worked in adult acute care. Her current role is on the surgical unit at a small community hospital. Her favorite part of her job is patient teaching, and she loves to travel and experience new cultures. In her free time, she enjoys snorkeling and hiking. So Taylor, can you share with us a little bit about Hawaii?
Gladly, and hopefully it all stays on the recording this time. So, in the state of Hawaii, advanced practice registered nurses include nurse anesthetists, nurse midwives, nurse practitioners, and clinical nurse specialists, and we all practice under the licensure authority of the State Board of Nursing. As far as having a collaborative agreement with a physician, in Hawaii, APRNs practice independently from physicians, and we are authorized to independently prescribe prescription drugs and schedule 2 through 4 and controlled substances. I will add that with the prescriptive authority, it is a separate thing that you have to apply for with the State Board of Nursing, and in order to receive your prescriptive authority in your training to become a nurse practitioner, you had to take a class in advanced pharmacotherapeutics, and you also have to every 2 years renew your license for prescriptive authority with 30 hours of continuing education in advanced pharmacotherapeutics. So that's just a little bit extra work that you have to do in order to prescribe independently. In our state, you do have hospital admission privileges. In Hawaii, it's within the APRN's scope of practice to admit and discharge clients for inpatient care facilities licensed as hospitals, long-term care facilities, or hospices. As far as being addressed as a doctor in our state, similar to what our other group members have talked about, it's not necessarily illegal. I found in my research that there are 7 states, Georgia, Illinois, Maine, Missouri, Ohio, Oklahoma, and Oregon, where there are regulations prohibiting nurse practitioners to call themselves doctor. So although it's not illegal in Hawaii to call yourself a doctor if you have a doctorate degree, I do think it's at the discretion of the nurse practitioner. I have come in contact with nurse practitioners practicing in Hawaii who all consider their title to be a doctor of nursing practice, and they will introduce themselves to clients as nurse practitioners. Our consumer choice grade is an A-, so it's pretty good. It represents that Hawaii does not limit consumer choice. As far as reimbursement compared to physicians in Hawaii, kind of similar to what our other group members have found as well, the Hawaii generally follows the same federal regulations, which are services paid at about 85% of the amount a physician is paid under the Medicaid physician fee schedule or Medicare physician fee schedule. But recently in Hawaii, nurse practitioners just recently, as this month, have passed a bill that allows nurse practitioners to be recognized as primary care providers, which I think will definitely change that schedule, or the physician fee schedule and the reimbursement for nurse practitioners. Along with my research, I found on the American Association of Nurse Practitioners website a map that shows the percent of physician reimbursement for nurse practitioners, and Hawaii was one of the states that indicated that they can reimburse up to 100% of physician reimbursement for nurse practitioners. So I think that it depends on the service that the nurse practitioner is providing. Our current political agenda is pretty exciting for APRNs in Hawaii. As I mentioned, just recently on July 10th, there was a bill signed into law that, on July 5th, there was a bill signed into law that recognizes nurse practitioners as primary care providers in Hawaii. And then even more recently, on July 10th, a bill was signed into law that adds advanced practice registered nurses to the definition of physicians in regards to signing off for workers' compensation. So slowly but surely, nurse practitioners are being added to those laws that specifically state physician. They're being added in there as a subcategory so they can perform the same services. As far as specific requirements for nurse practitioner students in their clinical practicums, I didn't find anything that indicated exactly the requirements depending on the program. I think that in Hawaii, in order to practice as a nurse practitioner, you have to have passed your national certification, your boards, and in order to do that, you typically have to have at least 500 qualifying practice hours. So those requirements, the specific requirements for practicums, come with your national license or your national boards. Excuse me. And as far as the specific requirements for students enrolled in out-of-state programs, I also didn't find very many restrictions on that. Just to reiterate, we do have to have a current national certification. So the clinical requirements that come along with that is what Hawaii is requiring you to have. That basically covers some key facts about nurse practitioners in Hawaii and their laws and regulations and what we can and cannot do. So, any questions about that?
Yeah, I have a question. Is there any restrictions or ratio as to how many patients an NP can see in an hour, and how do you feel about that in terms of quality care from a nurse practitioner?
Yeah, that's a great question. So I did see in some of my research that other states do have those limitations, but as you guys could probably tell from my my presentation, there isn't very much limitations on what a nurse practitioner can do in Hawaii. We do have a full practice environment, and we are granted a lot of autonomy in our care. So I did not see any specific requirements as to how many patients a nurse practitioner is allowed to see an hour. But I do think that on the more broad sense of this question, it's not necessarily a hindrance to have a limit on how many patients you can see, because if you are seeing only a few patients an hour, it really gives you a chance to develop relationships with that patient and to practice shared decision making with your patient, which will hopefully improve the quality of care that you're providing. But in general, we have a lot of autonomy, which I think does help us to provide good quality care for our patients. So.
That's excellent. Well, it's all been very interesting, and I certainly see kind of a common theme here where states are really starting to step up and see the need for more NPs, especially in those areas where in a rural environment, a lot of the new doctors are moving into specialty areas instead of family practice. And so that leaves a dearth of medical providers, especially for the lower income community. So I'm really happy to see many states are giving more autonomy and more ability for NPs to meet those needs. So this concludes our interview, and I've thoroughly enjoyed listening to all of you, and thanks for coming and sharing your valuable information. I've learned a lot, and good luck with your studies, and may you enjoy this path upwards and onwards to great things.
Thank you, guys. Thanks for your patience.
Okay. Have a good one, everyone.
Thanks.